So we're very excited to be here with you today because we very much believe that more and better information will mean better healthcare. And let me give you a little bit of background before I talk about what is possible today with personalized medicine, because it's actually happening today, and I want to share some of the results of what we've done with you. First, we support over 2,000 hospitals today and over 25,000 physicians. We actually are the IT department or run a significant amount of IT in over 350 hospitals in the United States today. So it's what we do every day. We have 10,000 people that get out of bed every day and do something to support a healthcare customer. Everything from the basics you'd expect Dell to do, to fixing a PC, all the way through to answering a clinical service desk call and assisting a doctor with finding the right order set. So it's big business for us. We have a great deal of data that we're the stewards for as well. One great example is our Dell Cloud Clinical Archive. We have 92 million clinical studies comprising 6.5 billion medical objects in our 6 petabyte archive that we manage for our customers today. This is all in a HIPAA compliant environment that we've secured against external threats. So again, this is big data. Also, Gartner has highlighted us as the largest healthcare IT services firm in the world. It's a big secret, so you're in on the secret now. I wish more people knew about that, but it's a big business for us at Dell. 17 of the top 18 hospitals on the U.S. News and World Report honor roll are Dell customers. 89% of the health and hospital networks, most connected hospitals, are Dell customers. So this is big business for us, and that's why we're here to talk to you about what we do for our customers every day. Now, in many cases, our customers are just getting their data into digital systems or into a single digital system so that they can make informed medical decisions. And most of what we do every day is get them the reporting to better run their institution, to demonstrate meaningful use, to make informed care decisions. Those are the basics. Unfortunately, the basics are unmet needs today in healthcare, and there are still lots of opportunities that we're working on every day. But let me share with you what is really the cutting edge in using data today to make informed care decisions, because that's exciting, and that's what we want to hear about, is not just what's possible, but what's happening. So I'd like to share with you what we're doing with the Translational Genomics Research Institute and the Neuroblastoma and Medulloblastoma Translational Research Consortium. That's a mouthful. But the project that we're focused on and are now undertaking is the first pediatric cancer trial using personalized medicine. So what does that mean? Well, first let me tell you about what neuroblastoma is. It's very bad. It's a very fast-acting brain cancer, and it's rare. It's relatively rare. Only 1 in 100,000 kids will ever be affected by it. But unfortunately, it accounts for 1 in 7 deaths from pediatric cancer. So it's bad news. Also, pediatric cancer is a grossly underserved market today. Since the 1980s, there have been over 50 oncology drugs that have been approved for adults by the U.S. Food and Drug Administration, only 1 for kids. Okay, so it's a terribly underserved market. And it's a market that we focused on along with education and making a difference at Dell. So knowing that, and it's a very rapidly moving disease, the speed to diagnosis is really important. And really the speed to diagnosis in this case is how do you get a genotype of the patient and the tumor as quickly as possible and get that to the tumor board so that they can make an informed care decision from 150 different oncology drugs and make an informed care decision. So that's really what we've done, and we've worked with the lab, the instrument maker, as well as the data analysis to move a process that originally took 2 weeks down to less than 2 days. And we've sped up the analysis of that data, which took days and days by over 1,200%, and it's done less than a day, so that we can diagnose kids very rapidly, get the information to the tumor board, and also it's shared via a HIPAA-compliant cloud, because the tumor board's made up of people from all around the country, so that they can look at the data, participate in the care-making decision, and make a difference in these kids' lives. And let me just share with you, my final statistic I'll share with you is that typically the response rate for neuroblastoma is between 5 and 15%. It's a really sad situation. The initial results have shown us that we see a positive response rate of 64% in this trial. So it's very encouraging and something we're very proud of working with the Translational Genomics Research Institute. So thank you very much for your time today.